Workers at risk. Why is this so, and what is government doing about it? Well, you know, as I said in my presentation, healthcare workers are at the front line. And I have to say, it's not only healthcare workers. There are so many other workers in other sectors in government who are at the front line interacting with individuals. Take, for instance, the border points where we have truck drivers coming in. We have immigration officers there. We have police or security officers there. We have port health officers there. All of these will get in contact with first line, with people who may possibly be infected. And we do know cases where these things could even be transmitted through documentation that is being circulated around those offices. So healthcare workers, yes, the healthcare workers are the direct ones who will be dealing with COVID cases, but we have a whole range of other frontline workers who are also exposed to this virus. This is a risk. It's an occupational risk. And therefore, from time to time, we are likely to see that these individuals may get infected, not because that they are not well protected, because I think in terms of, and this is answering the question what the government is doing, is to ensure that we are providing the necessary protective gear to these frontline workers, both healthcare workers as well as other health workers in this front line. We are providing them with the necessary gear to be able to make sure that they are protected as they go about their duty from contracting the virus. So we're talking about the PPEs, the gloves, the sanitizers, the containment measures that we have put in place, that they are in place and observed in these places in order to protect the healthcare workers. I have to say that in this regard, I think the government has done quite a bit in terms of ensuring that these PPEs and other commodities are available at those points where healthcare workers need them. And we will continue to place great emphasis on PPEs. In fact, if you look at the kind of expenditures that the ministry and the counties are undertaking, it is to a large extent, much of it is going into PPEs for the purpose of protecting healthcare workers, protecting others, and generally containing the spread of the virus.